Leader of the third party.
Thank you, Honourable Speaker, and I'm listening very closely to the questions and the responses because I think this is something that British Columbians are very concerned with. And the report that came out by Ian Young for the South China Morning Post found that from November to February, 192 British Columbians died in long-term care homes in Vancouver Coastal and Fraser Health under a change in policy where authorities did not declare outbreaks when an employee first tested positive for COVID-19. These are important questions to be asking, and I think that they merit a response from the Minister that acknowledges that British Columbians, citizens, do have a right to know and understand these decisions, and that government is recognizing the seriousness of the implications of these decisions. As has been identified by the official opposition, the investigation found that it took on average 4.7 days between when an employee tested positive and when care homes found that the case had spread beyond the first individual and into the wider community. And it's challenging, Honourable Speaker, to hear the term enhanced surveillance being used to describe less communication and less monitoring and testing during a pandemic. So my question, Honourable Speaker, is through you to the Minister of Health. What was the goal of this strategy, and was that goal met?
Minister of Health.
Thank you very much, Honourable Speaker, and I absolutely agree with the member that a serious debate is required. With respect to outbreaks in long-term care, from the beginning of the pandemic, our medical health officers took a rigorous and disciplined approach throughout the pandemic. And that was reflected in the declaration of outbreaks frequently, where there was only one case and only ever one case. With respect to those healthcare facilities that were subject to the enhanced protocols or the enhanced surveillance, they had different names in the two health authorities. Many of those cases, in fact, 80% of those where such a technique was applied, resulted in no outbreaks, and others resulted in outbreaks. And this is what occurred. But when the member says that no action was taken, in fact, very significant action was taken immediately, and then more action was taken as they went forward. These were the judgments made by the people that we put in these positions, medical health officers with 5 years of training and deep experience who make very difficult decisions about outbreaks, decisions that have implications in every sense, implications for the people who live in long-term care and for whom it's their home on the one hand, and the need to keep people protected. And I think our approach in British Columbia has been the right approach. That means from time to time that medical health officers make changes in their approach to it, for example, with respect to recommendations about visitors in BC. And these are the decisions we would expect them to make in order to help keep people safe, but also to recognize the profound impact of the pandemic on everyone in long-term care in every way, even those ways beyond COVID-19.
Leader of the third party on a supplemental.
Thank you, Honourable Speaker. And I think that it's important to note that there were 42 outbreaks during this period in long-term care homes, 1,000 cases, and as has been pointed out, over 190 deaths. Before November 9th, 2020, Fraser Health was directing its long-term care homes to treat one positive COVID-19 case as an outbreak and to impose tight restrictions on its staff and residents. After November 9th, the directive was relaxed. In the week before this decision, BC's 7-day average for cases was growing exponentially. The government made a choice to relax outbreak standards in long-term care homes in the middle of the growing second wave of COVID-19. That choice was questioned at the time by both BC's seniors advocate, Isobel Mackenzie, and Terry Lake, the chief executive of the BC Care Providers Association. Both advocated at the time for more testing and brought their concerns about the repercussions of this policy change to the Minister of Health. My question through you, Honourable Speaker, is to the Minister of Health. Why were the rules relaxed for long-term care homes in a growing second wave? Who made the choice, and was it approved by the Minister?
Minister of Health.
The decisions around whether an outbreak is declared are statutorily the responsibility of medical health officers under the direction of the provincial health officer. And I support the provincial health officer, and I support medical health officers, and I will continue to do so. With respect to Isobel Mackenzie, during this period, she was not wrong or right to do that, strongly advocating for more visitation in long-term care and, in effect, a relaxation of some of the measures that were in place in order to deal with the social consequences of COVID-19. The idea that Isobel Mackenzie, and I don't think this has been suggested, I don't think by either Ms. Mackenzie or by Terry Lake, that they came to me and talked to me about this in particular, is just not correct. I don't believe, I don't have any recollection of it, and I don't think it's true. I think they were arguing for different things, and that's a different discussion. We shouldn't conflate these issues. These issues are very serious, and the provincial health officer consistently has taken a strong position in BC with respect to the declaration of outbreaks in long-term care, and will continue to do so.